Once again, welcome to Garden of Fertility by this time. Due to network issues in our location, we have to go off yesterday. Yesterday, we made an introduction about fibroid. But before I proceed, I would still like to introduce myself to you. I am Opera Stella Thelma. I'm a medical laboratory scientist by profession and also a certified fertility counselor. So, we are creating awareness about fibroid. This fibroid we are talking about has caused a lot of havoc. It is part of infertility problem that have been facing a lot of people today, and especially women, those who are not properly oriented. They end up by believing some myths and legend about this uterine growth. Yesterday, we've been mentioned about what is this fibroid? What is this fibroid all about? This fibroid is a growth that normally happens in the uterine or the wall of the uterus. We said yesterday that this growth can come like a seedling till it grows to a bigger size, to the extent of occupying the uterine cavity. Now, we have multiples of this fibroid. It can come in a single form. Now, many a times, in rare occasion, it can be cancerous, but normally fibroid is a benign growth. So, this growth have caused a lot of havoc, and some people are looking for solution where there is no solution. And I will advise you as my person, as a counselor to you, I will tell you nothing but the truth. A lot of people have been taking some herbal medicine, and I will tell you what I know, and nothing but the truth, that no herbal drugs can melt fibroid. How I wish each and every one of you can see and feel it, and feel how this fibroid tissue looks like. Yes, how I wish you can see and feel it. Because some people have been hearing about it, seeing the picture, how I wish you can feel it and touch it and know how it looks like. And you will know that no herbal drugs can melt this fibroid. By the grace of God, I'm a histopathologist. I specialize in histopathology. Many a times in the cut-up room, if you don't use a very sharp knife, you cannot cut this object. Many a times I call it monster. Yes. I call it monster. When you look at it, you will not know what it looks like. So, that is it. Now, many people have been asking, what are the cause of this fibroid? I stand to tell you today that nobody knows the actual cause of this fibroid growth. But there was a trace to estrogen dormancy in the body. When the estrogen is high, I told us yesterday about our hormones. That we have estrogen, progesterone, luteinizing hormone, follicular stimulating hormone, and prolactin. That are the major 5 hormonal profile tests. So when your estrogen, meanwhile, in the lab result, it may appear like an estradiol. Yes, it's called estradiol when reporting the test. So when, sorry. So this estradiol, when it is high, there is an inflammation in your body. There is a growth. And the only way you can confirm this growth is through pelvic ultrasound. When you go for a pelvic ultrasound, to dictate and know how your reproductive system look like. So, we have many types of this fibroid. And to an extent, there are some traits that this growth can be genetic in nature. Maybe somebody have passed through this in your family, or your mother have fibroid in the past, or anybody have such issue in your family, and there is a repeated occurrence in your own time. It can be as a result of what we eat. When you consume excess carbohydrates, carbonated water, that can make your estrogen to be high. So what you eat matters a lot. So when you are not eating a healthy diet, you see that this growth keep on coming. It keep on inflecting. It keep on increasing day by day. So, and this fibroids mainly feed on blood. It feeds on blood. So many a time, some women that have this fibroid, after menstruation in the month, they begin to suffer for anemic reactions. And this anemic reaction is as a result of this fibroid growth. And this have led to some abdominal pain, painful menstruation, inflammation, and cramp. Yes. Some people, no matter the level of drugs they take, exercise, and the rest, every month they feel this pain. They feel this terrible pain caused by this monster. So now, there is a trace that when you are able to minimize your intake or reduce your estrogen level, there will be an elimination on the growth. So therefore, you need to know the foods that increases your estrogen level. When you don't know those foods, you keep on eating everything you see, everything you like. Even many a times, some people will go for surgery. After surgery, within 1 month, 2 months, there will be a regrowth. Even after 1 year, there will be a regrowth because you are not properly oriented. But when you are told the right thing to do, you can stay 5 years, 6 years, even till you finish giving birth. You will not see that regrowth. If you can be able to follow our meal plan, if you can be able to curtail your carbohydrate intake, it can help you to go a long way. It can help you to do what? To go a long way. So here we have many types of fibroid. Number one is common type of growth. It grows inside the uterus wall. It makes the uterus feel large than normal. Yesterday, I told us that this growth, about 80% of women have this growth, but some are not seeing the sign. 30% are not seeing the sign. They have it, but they don't know they have it. 30% can conceive with their own because of the location. So now, to know whether you will be able to conceive or not is to know the location of your own. And when you have tried to conceive and it's not working out, then you have to look for alternative on what to do about it. We have subserous fibroid. This one grows in the outer wall of the uterus. They are usually unnoticed. They are usually unnoticed in the body until they become bigger. Until they become what? Bigger, that they will press other organs surrounding them, such as the bladder, the rectum. So you can have subserous. You may not know until it starts pressing some major organs around them before you can know you have it. So, as I said before, many women have this fibroid, but they don't know they have it. They don't know they're having it inside of them until when it comes to the time of conception and it's not working out, they will notice or they will feel it after some examination that they have this growth. So we have another one, submucosa. Submucosa is developed under the... These are fibroids that have most of the heavy... Those people that have menstrual pains, menstrual bleeding, they're having submucosa fibroid. It makes you to bleed more and can cause problem of infertility and miscarriage. This subserous, it can cause miscarriage. It cannot allow a baby to stay in the womb. And this is the major one that causes infertility. So when you go to a scan, pelvic scan, and the doctor tell you that maybe you have a subserous fibroid, know that it is a very dangerous one. It can hinder you not to conceive. And if you try to conceive with it, it can cause miscarriage. So take note of that. Now we have another one. We have penucleated fibroid. This one, you may not see it through the scan. Yes, you may not see it through the scan. Many a times you may see it through the scan. But it grows at a stage that connects to the inner or outer wall of the uterus. It is attached to the uterus. It is attached to the uterus. In subsequent time, I will bring out the diagram for you to see how this works. So we have other one. Many times it can grow inside the womb. We have some fibroid attached to organs such as the tubes, etc., or the lobe of the bowel. So your growth can come in many ways. We have interligament fibroid. It can grow a sideway. It can grow at a sideway between the layer of the broad ligament. So many people have multiple growth of this fibroid. So what are you going to do? You have gone for a pelvic ultrasound and you discover that you have a fibroid growth inside of you. So what are you going to do? A lot of people have passed through that stress. A lot of people have passed through that challenge and they have their testimony today. They have conceived. What are you going to do? Are you going to keep silent? Are you going to start with self-medication? Or somebody may tell you, if you take this one, you will shit everything out. Somebody will tell you this and you accept it that way. Those who have been taking herbal medicine for years, how far? What is the possible result you have gotten? What are the possible results you have gotten in taking all these herbal drugs? So that is what you need to ask yourself. A lot of people have damaged their system, their kidney, their bladder, their tubes as a result of these herbal drugs. I'm not here to castigate any herbal drugs. It's working, yes, herbal drug works. But when it comes to this fibroid, my dear brothers and sisters, please, you need to desist from that mixed and legend. People telling you that when you take it, it will melt. My dear, it's a fallacy. Don't believe that fallacy, okay? Some people, after taking this drug, they will still go for surgery. The only possible way to overcome this, first, you need to go for surgery. And when you now go for surgery, you have to regulate what you eat. You have to be under a meal plan that will help you to regulate your system, to reduce your estrogen dormancy. And when your estradiol is normal, you can see the growth may not be able to be there. So in subsequent time, in our next video, I'm going to tell us what we need to be doing. And also we have a book, we have an ebook, how to have a successful pregnancy with fibroid. I recommend everybody to get this book. It will help you a lot. It will help you to have the understanding of what you are passing through and to know the possible way on how to overcome it. The solution is there, but you need to seek your solution in a rightful way to avoid causing more harm on your body system. So, some people keep on blaming themselves. Maybe they are the cause of. No, you are not the cause of the problem. It's nature. It's how God made it. If your own happens to develop, you take it that way. That is how it is. So, what you'll be looking at, what is the solution? What next? What will I do? How will I overcome this? By seeking the solution, you seek it in a rightful way. Now, we have a lot of gynecologists. We have experts. We have surgeons. I do encourage people as a fertility counselor to look for a gynecologist, a specialist, not just a gynecologist, but a specialist that handle issue of fibroid. Many a times we recommend people to go to a better hospital, a place you will go, and after this surgery, I promise you 6 months you will take in. 6 months you will take in. I am not just telling you, I'm not just marketing anything, but I'm telling you what I know. People that are specialists. People that after this surgery, they will monitor you, they will give you a meal plan you will follow till you conceive. Even if you are finding it difficult to conceive, they can help you to do IVF in a moderate amount. So the solution is here. If you are having fibroid, there is hope. There is 100% hope. No matter how you get to the journey of parenthood, it's a testimony. If you think it's not a testimony, many people have tried that thing you have done, but they're not getting results. So no matter what you do or how you did it to get pregnant and give birth, it's a miracle. So you have to appreciate it. So in this awareness we are creating, so I want to bring to our subconscious mind for us to have the orientation of what we are passing through. It's not a suicidal case. It's not a death sentence. You will still overcome it. You will still come out of it. But one thing I'm telling you is that you don't need to delay on this journey. I've seen so many people, they say they're scared to go for surgery. At the end, when they will go to surgery, their menses will just go like that. So be wise and think fast. Get yourself ready, prepare yourself, and you will get the best. With the help of God, you will come out of it. So I want to encourage my fellow women that fibroid is not a death sentence. If they have been causing a hindrance for you to conceive, it is possible, it is curable, it is treatable. When you follow the rightful step, you will get a better result. So I want to thank you all that have watched this section this afternoon. I want to encourage you that since you stick to this channel, you are an overcomer. You will come out of it with testimony. So I really appreciate everyone for being part of this section today. Thank you so much. See you by this time tomorrow. Thank you very much. Stick to Garden of Fertility. You will hear more educative things that will help you overcome your fertility challenges. So, you are blessed.